There's a growing body of evidence showing that adding calcium to your diet is a risk factor for cardiovascular disease, coronary heart disease, stroke, and even death. So let's unpack the science and give you the best advice, not just the usual recommendations. In addition to the best formula to remove any adverse effects of calcium intake on your health, one of the first studies on the effects of calcium was published in the British Medical Journal. This was a large study analyzing data from 11 trials. The research showed that those who took calcium supplements were 30% more likely to have a heart attack. Let's see one massive study on calcium supplements, and then we'll see if the same is true of dark calcium. This study had 388,229 participants and discovered that men who took 1,000 milligrams of calcium per day had a 20% higher chance of dying from heart-related causes. This next study of 43,000 participants found that even dietary intake of calcium significantly increased risk of heart disease. Just to confirm, this other study of 61,433 women found that calcium from the diet above 1,400 milligrams was associated with a higher death rate from all causes. So let's look at the standard research advice first, then the optimal health advice. Don't exceed 700 milligrams in your daily diet, and if you have to take tablets, then don't exceed 500 milligrams. Obviously, stick to dietary sources is the best advice. Now the optimal advice, try to replace some animal sources of calcium with dark green leafy vegetables that are rich in calcium, like spinach. Take a vitamin K2 supplement that prevents the calcium from being deposited in the arteries. Plenty of good evidence for this. And that's it. Please check out our other Health Doctor videos on how to optimize your health naturally. And thanks for listening.